Hi, my name is Warda. I'm going to be interviewing you today.
Hi, my name is Khadka, and I'm student currently studying in Western Sydney University. I'm doing my master's in nursing. Thank you so much for your opportunity today.
Yeah, so nice to meet you. I'm going to ask you three questions. Are you ready?
Yes.
Okay, so you have witnessed a medical officer approach a patient or woman to examine them without washing their hands. You know that this is against infection control policy and practice. What are the professional, ethical, or legal issues you would consider, and what actions would you take?
Thank you for the question. As a nurse or healthcare professionals, we are accurately aware of the critical role and hand hygiene plays in infection control. Failure to follow these protocols can lead to the spread of infections, uh, posing a direct threat to our patients' health. Hand hygiene is the most effective tool to prevent healthcare associated infections and ensure the quality of care we provide to our patients. As a RN and healthcare providers, we are bound by an ethical duty to prioritize the safety and well-being of our patients. Neglecting this duty is a mean to compromising on our commitment to the care. The principle of do not harm is at the core of our profession, and any action or inaction that jeopardizes patient safety is a violation of this principle. We are ethically obligated to adhere to principle uh, and establish protocols and quality standards of the care. So, seeing a medical officer who was not performing hand hygiene, I will politely approach that medical officer and remind him that he might have mistakenly forget to wash his hand, or I would kindly direct him to the hand hygiene facilities, pass him the hand sanitizers or gloves around him, or also show him the sink where it is near to him so he can wash his hand quickly. If he does not listen to me, I will explain to him the consequences of failing to follow infection control policies. Um, it can be considered as negligence and also lead to the legal consequences if a patient contracts with the infection. So rules requiring infection control methods are enforced in healthcare facilities. So failure to comply can lead to restrictions and loss of certification. So if he doesn't still listen to me, I will report the incident by documenting um, the incident, including the details such as the date, the time, the his name, and also. If they still repeatedly ignore the hand hygiene policies, I would escalate this situation to my manager or supervisor, or also whoever is in charge of the infection control department. As a healthcare professionals and a nurse, it is our duty. It is very important that we effectively participate in hand hygiene training sessions. These sessions not only reinforce the importance of hand hygiene, but also equip us with the knowledge and skills to uh, encourage our team members to adhere to these protocols. By promoting this hand hygiene, we ensure patient safety and protect ourselves from the potential infections. Thank you.
Okay, thank you, Ashka. So, question number two, a fellow registered nurse or registered midwife arrives 30 minutes late for work regularly, which means that they often miss the handover period. How might this impact on the assessment of a patient or woman's needs and the care provided, and what actions would you take?
Um, for me, the handover period is very crucial and important because it is a time where I get to know the patient's details. Because my fellow team members, they will be sharing information about patients, which includes changes in condition, care plans, and any concerns that we need to put an attention on it. So missing this period for me means that we have not got the information which we need. And also I believe punctuality is very important. I like to go to my workplace at least 15 minutes early to be prepared with all of my essential stuff. It is always a plus point, I feel, to go to the work and start early so I can get my stuff ready and even be mentally prepared. As a nurse, going before on time is very important so that we can start printing out the handover sheets and getting more information about our patient. So it is a very plus point to go before the time. So as a RN, it is very important because incomplete handovers can lead to missing critical information, resulting in potential harm to our patients, such as medication errors, and then missing the treatments or the care we should be providing them, and overlooked symptoms. When we nurses miss handovers continually, the care is disrupted. This can affect the quality and consistency of our patient, and also potentially lead to the fragmented care and decreased patient satisfaction. Other nurses may have to, my other friend who is missing our handover, may have to, may give overload work to us who's working and who's coming on time. Other nurses may have to cover for the late arriving nurses, increasing their workload and potentially leading to burnout and decreased morale among the staff. Other team members who arrive on time may perceive it as unprofessional and unfair. I would like to take action to my fellow friend, registered nurse, uh, sharing the understanding that I have, that the importance of arriving on time and receiving handover on time um, um, is very important. I would talk to her or him on private, like non-confrontational conversation with the nurse about their tardiness. I would explain the impact it has on the patient and the care we provide. And I would discuss the importance of punctuality and the critical role the handover period plays in the ensuring patient safety and effective care. Um, if the fellow member RN doesn't listen to me and the issue persists, I will report it to the supervisor and manager. I would document the occurrence and the impacts observed on patient's care. If any of the team members make a habit of coming late, it is very important to ensure that there is a protocol in place for latecomers to receive a brief, comprehensive handover from a colleague or through document notes. I would monitor my RN fellow member, their punctuality and the effectiveness of any measures taken. By addressing the issue constructively and ensuring that all team members understand the importance of timely handovers, I think we can help maintain a high standard of patient care and foster a supportive and professional work environment. Thank you.
Thank you for that. So the last question, how do the New South Wales health core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse or registered midwife? Provide an example from your clinical practice.
Um, as an RN, NSW Health core value is very important. Core value stands for collaboration, openness, respect, and empowerment. This value relates to my practice. For example, collaboration involves working effectively with work teammates, with team members, effective communication to understand patients and other health team members, and participating in multidisciplinary teams. For example, in my nursing placement, I worked in operation theater with RN surgeons, anesthetics, and other healthcare providers for a patient who had undergone bone marrow transplant. I was able to work with RNs and provide the proper equipment for our patients for incubating procedures, such as suction, appropriate size bag, mask, oxygen source, and then endotracheal tubes, including a larger and one small sizer, laryngoscope, and laryngoscope blades. So it had helped me a lot to bring a good communication among my teamwork and and provide a proper care to my patient. Talking about the openness, it is very important as an RN because nursing means openness in nursing means being transparent and honest in communication with our patient, family members, and teamwork members. I am always open up to learning more. I like to receive feedbacks so that I can improve myself to do more better in clinical performance. It involves admitting mistakes, sharing information freely, and being open to suggestion or feedback that we might get from our colleagues or educator. For example, in my clinical placement, I once made a mistake in filling out the observation wrong. I mixed up the obs from two different patients and I hadn't realized it. After a break, when I came back, my RN told me about how I had misplaced the obs and that from that time I always double check my right patient and make sure it is the right observation that I'm filling out in the EMR. I also got many feedbacks from my facilitator, which has helped me to reflect on the mistakes that I have and that I have made and not to repeat it again. Overall, it had been very good experience. uh, as talking about respect, respect involves uh, each individual's valuing each individual's dignity, rights, and cultural diversity. It includes being empathetic and having compassion towards the patient and people we work with. Listening to patients' needs, their needs, courteously treating colleagues, and maintaining professional boundaries while caring for the patient in my placement, connecting with others, expressing our gratitude is very important. I met people from different cultural backgrounds. It took me extra time to understand the preferences. I always like to talk to my patient with kindness, such as calling them with their preferred names. It is very important for us to ensure that we care. The care we provide to the patient is respectful towards their culture, religion, and beliefs. This approach helped me uh, build a trust. Uh, Build a trust with my patient and bring assurance to the care I provide to them, and my patient felt valued and understood. For the empowerment in nursing means enabling patients to take an active role in their care and encouraging colleagues to develop their skills and knowledge. I believe I have the ability to effectively motivate and bring the positive outcomes in nursing practice and work environments. It involves education, support, and fostering independence. For example, providing education to our patients about the disease they have and what and diets they can eat on time. When patients are sick, they are going through very mental going mentally also mentally weak. So having giving them those support, giving them those education is very important. I had a patient who had flaky skin and her skin was ripping off, so I suggested that she can wear body lotion and keep her skin hydrated, and she was very happy. So just a small education, just a small sharing to our patient can be very important for them. Therefore, as a nurse, it is very important we carry and reflect on these core values. Thank you.
All right. Thank you, Ashka, for taking part in this interview. Have a good day.
Thank you. I'm gonna